Welcome back to Open Line. We have one last segment here for you to call in and ask your questions of Dr. Amy Bono. Of course, our theme this week is about getting children safely back to school. And tonight we take the medical perspective. Many doctors across the state calling for a delay of in-person schooling, though the governor really pushing back against that and saying, oh, it's time to open our schools and in fact not delay them whatsoever. And many districts are moving forward with plans to at least offer in-person classes to those who want to take advantage of it. As I said, Dr. Amy Bono has been our guest. She is a primary care physician here in Middle Tennessee. Dr. Bono, one thing that a lot of people have been watching, our state leaders and health leaders, is hospital capacity. Explain why that is such an important metric to watch.
Well, healthcare is a limited resource, and just to understand that whenever we are using so many hospital beds or so many ICU beds to care for coronavirus, we don't have enough capacity to care for non-coronavirus illness. For example, if you need your gallbladder removed, well, there might not be a bed available for you to get that care. If you are in a motor vehicle accident or a boating accident and you need urgent care, the nearest hospital very well may be on bypass because there's no capacity to take you. So you could have a severe consequence of that simply because the ambulance has to take you farther away and you can't get medical care immediately. So when it comes to our hospital capacity, it's important to understand that that's a metric that should help guide our behavior, because we can't care for you if we're also caring for coronavirus in the hospital setting. There might not be room. So you should be self-interested in keeping coronavirus under control. You should be self-interested in trying to wear a mask, because we know we need to control coronavirus to help decrease our hospitalizations.
And also reopen our economy, get people back to work and businesses back open, which we've seen kind of bounce back and forth throughout this summer, whether we can be open or closed. As you talk to parents, as inevitably children are going back to school in this state. They have already started and they will continue to in large amounts over the next couple of weeks. What do you want parents who have chosen this for one reason or another, and there are a lot of reasons to send kids back right now that parents are saying this is the option for my family. What do you want them to keep top of mind?
You should be cognizant of your child's health. You should keep your child at home if you feel like your child is sick. You should support your teachers when it comes to the rules that they have laid out for their classroom. I would encourage you to to enforce mask wearing in the school yourself, because ultimately wearing a mask is something you can do to protect others, and there's evolving data to suggest it could protect your child. So I would make sure that there's appropriate cleaning supplies, and call attention to maybe the lack of soap here and there, or the lack of appropriate cleaning here or there, because we need to wash our hands, we need to not touch our face, we need to wear a face covering, and we need to maintain physical distance. So I would encourage you to support your teachers and the rules that they have laid out. I'm a little bit worried that there could be a little bit more bullying and bullying behavior in schools.
Over the mask issue or something else?
Potentially, yeah. Potentially over the masking issues, yes.
Hopefully one thing that's happened over the last several weeks is more and more people are wearing the mask. It's become normal out in society now, and kids have seen it because they have been out too. They don't live in a bubble in homes. It's just not possible for a lot of families to do that. Also, as we look at schools and different models they're having to follow, even for parents who are choosing to send their kids back to school, they may be on a hybrid schedule, and that's meaning they're having to figure out what to do with their kids on other days a week. And I know a lot of parents just in my own sphere are saying, okay, my kids are going to be in school 2 days a week, and then they're going to this extended camp thing, or they're going to this learning center, and it's increasing the bubble that they're in instead of just staying within their classroom 5 days a week. What's your perspective on that as a doctor?
One of the things that I have approached is the concept of germ bubbles, not just the number of people, but how we're cohorting individuals, if you will. So it would be best to not have as many cohorts, meaning you have your known contact. And that makes it easier as a public health official to do contact tracing. And so part of, I think, the hybrid approach where you're trying to find extra care is that, yes, it does open your germ bubble up. It does increase your cohort numbers, and thus it will make contact tracing more difficult, and it would possibly lead to, just more closure in general.
Do you think it's better to just keep kids in school then 5 days a week rather than do this hybrid that a lot of districts are going to and they're doing that if parents or folks who are watching don't understand, so they can create more social distancing in a classroom. Only half the kids come on a Monday, Wednesday, the other half come Tuesday, Thursday, and then they can spread them out. But then what do you do with the kids when they're not in school?
Well, I have to take it back to the top of the broadcast and say we have to focus on transmission in our community. We have to focus on transmission rates. We have to focus on case positivity. So at this juncture, our state of Tennessee is at a very critical moment of our coronavirus response. And at this juncture, our community transmission is exceedingly high. And I would not recommend in-person education at this point in time until that community transmission is lowered.
Do you think that children can learn effectively online of all ages, kindergarten through senior year?
I'm not a pediatrician. When it comes to the younger children, meaning younger than age 10, I would say, and I use age 10 primarily based on contact tracing data out of South Korea. I use age 10 when it comes to evolving evidence to say that children that are younger than age 10 tend to not transmit the virus as readily as older children. So whenever I say age 10, that's where I'm leaning on scientifically, is the way that those younger children can transmit virus less so than the older children, older than age 10. So this might actually be a point where science and social studies kind of meet up to say that those younger children clearly have a greater need for that social interaction, and they need that aspect of their life to develop. Middle school and high school kids, kids older than 10, they possibly have the ability to learn online, and yes, they're going to miss something, but maybe not miss as much as those children younger than 10. So again, maybe the transmissibility of the virus in children younger than age 10, maybe that is a place where, again, science and social studies could meet.
Sure. Interesting. Dr. Bono, thank you for your time tonight. We do appreciate it.
Thank you. Thank you for having me, and thank you for the callers. Thank you.
Absolutely. Okay, we'll be back right after this.